UnitedHealthcare and Johns Hopkins Medicine are at a standoff. Their contract expired in late August, and the result is that tens of thousands of patients across Maryland, Virginia, and Washington, D.C. just lost in-network access to Johns Hopkins hospitals, doctors, and clinics. The only exception is Johns Hopkins All-Children's Hospital in Florida, which remains in-network. On the surface, it looks like the same dispute we've seen before. UnitedHealthcare says Johns Hopkins was demanding unfair terms and refusing to compromise. Johns Hopkins says United is adding layers of bureaucracy, prior authorizations, denials, and delayed payments that hurt patients and slow down care. Each side claims they're standing up for patients. But here's the reality. Families are the ones left scrambling. Imagine waking up to find your trusted doctor or hospital suddenly out of network. Cancer patients in active treatment now face uncertainty. Parents with children in Hopkins Pediatric ICU are looking at potentially hundreds of thousands of dollars in bills. For many, it feels like their care just turned into a luxury product they can no longer afford. Patient advocate Matthew Zachary, himself a cancer survivor, spoke to this in a recent post. He wrote that this isn't a broken system. It's the system working exactly as designed. He argues that insurers and hospitals treat patients like poker chips in a high-stakes game, while regulators look the other way, and the public has become conditioned to accept medical bankruptcy as normal. He warns that if continuity of care can vanish overnight because of a contract dispute, then no one is truly safe. This isn't just theory. The Maryland Insurance Administration has already launched an investigation into UnitedHealthcare, looking at whether the company is living up to its legal obligations to provide continuity of care for patients in the middle of serious treatment. Under state rules, patients undergoing ongoing therapies, such as chemotherapy, surgeries, or clinical trials, are supposed to be granted temporary in-network protections, often for up to 90 days. Regulators are now digging into complaints that this process isn't being handled the way it should. What we're watching is bigger than one contract dispute. It's about who holds the leverage in American healthcare, and right now it isn't patients. For seniors on Medicare, this is a reminder of how critical it is to understand your options. Medicare Advantage and employer health plans can make sudden changes to networks, premiums, and benefits. Medicare supplement plans, on the other hand, cannot drop you from coverage or change their core benefits. Knowing the difference can mean stability when stories like this hit the headlines. If you have questions about your coverage or want help reviewing your Medicare insurance options, the Senior Savings Network is here to walk you through the choices and find a plan that fits your needs.